I've married to Jim for 43 years now. We have 2 sons that are wonderful. We have 5 grandchildren, 1 great-grandson, and a great-granddaughter who's due to be born any minute. They're everything. They are everything, all of them. Without my family, I can't even imagine going through what I've gone through. I wouldn't have gone through all of this without the love and the support I've gotten from my family.
This treatment device is used a lot of times, many times, in patients that have, like Dana, failed multiple, not 1, not 2, 3, 4, multiple back surgeries, multiple medications. She's already on extensive amounts of medicines. She's tried physical therapy. She's tried injections. All of these have either done nothing or provided a temporary relief or, just a little bit of relief, but nothing to make her normal.
My name is Dana Knapp, and I've been in pain since at least 1973. Actually, since I was 2 years old. So I live in Kauai, the island of Kauai in the state of Hawaii. Well, when I was 2, I guess I twisted my leg in a chair or something, and we lived out in the country and kind of in the wheat fields. And all we had was a country doctor, and he came out and wrapped a telephone book around my leg, and that was my cast. Couldn't tell if it was broken or not, because of course we didn't have any x-ray. That was the beginning, and then as I began to grow, one leg, I kept limping because one leg got shorter than the other, shorter than the other, and shorter than the other. And finally, at about 7, it was diagnosed as Calvé-Lake-Perthes disease. And they began to treat that. I felt different. I felt different than the other kids. And I tried to keep up with them. I tried to do the things that they did, but I couldn't. Although I did try. I tried to run with the crutches. But there was one place where I felt that I did keep up, and that was in the swimming pool, because you are weightless in a swimming pool. And I wasn't allowed to put any weight on my leg at all. So in the swimming pool, I'm weightless, so I was able to keep up with the other kids and even excel. I felt at home in the swimming pool because I was just like everybody else.
I really only met her when I was maybe 4 or 5. Technically, we're not blood, but my mom married her son, and she immediately took us in, and for me that was monumental because I really needed it at the time. So the main thing was for me that I had a lot of anger issues. I'd have a really rough week with my mom and my dad, and I knew Sundays were my paradise day because I always knew I was going to my grandma's house.
I'd say it's a testimony to her perseverance because she is still able to stay vibrant with family and do her best, but at the same time you can see as the day goes on how much she is suffering from the constant pain.
I just hope it lessens the pain and helps her in any way it can, just so she can, not have to worry so much about it every day of her life.
Yeah, I mean, you can see it in her face, in her eyes, that she's in pain. She tries to hide it, but she can't, Very proud of the person that she is with the pain that she's always under, because she just takes it in stride and keeps going.
She's always been the shoulder that you can lean on. She's always been somebody who's never going to judge you no matter what you say to her. There are a lot of things she can't do right now. A lot of things that I remember her doing as a kid, like going on bike rides up the mountains with my grandpa, just for the fun of it. That was, I know, one of her favorite things to do.
I believe it was 2000, I finally realized that there was really something wrong with my back in addition to my leg. So we started with the laminectomy decompression in the year 2000. Yet for 6 months I was in so much pain I could not get off the couch. I did go back to that same orthopedic surgeon, and I had a 3-level fusion at that time. And that helped for a while, but then the pain came back. I think I got maybe 6 or 8 months out of that one. So we went to a neurosurgeon instead, the third time. And the recovery, waking up in the recovery room from the third surgery was absolute agony. And for a while, that one worked. And that then had given me a 5-level fusion. But unfortunately, a 5-level fusion takes the S-curve out of your back. So you, with time, because your back is now completely straight and held in place by hardware, I began pitching forward. And so the pain was gradually over the years became just excruciating. It affects your knees, it affects your hips, and of course it affects your back. Siwek at the Pain Center of Arizona, I went to see him, and he treated me and helped me enormously. But about that time we moved to Hawaii, and unfortunately Dr. Siwek doesn't live in Hawaii. His practice is here in Arizona. So he sent me to a neurosurgeon, and the neurosurgeon at that time said, you need to have the S-curve put back in your back. So I had a 4th back surgery. They took out all the old hardware, and they fused, I think I have a 9 or 10 level fusion now, and they actually cut a pie-shaped section out of one of my vertebrae and compressed my back in the operating room, and then screwed everything together. And when I woke up in the recovery room, it was beyond excruciating, and I was in ICU for 3 days. I was begging to die. All I wanted to do was die to escape the pain, because it was beyond what a human being can stand. And my husband has been through all of this with me, and he wanted to rub my head, and I couldn't stand to be touched. I couldn't stand for him to even touch my head, because I hurt so bad from head to toe. I can't even describe it for you. And he stayed with me through the whole thing. Even though he couldn't touch me, he stayed there with me through all 4 days of agony. He stayed there until they got the pain where I could bear it. And then he finally went and got something to eat. So he was my lifeline, and knowing that I could still go back and see Dr. Siwek was also a lifeline to me, knowing that if I could survive this, and I think without my family I wouldn't have survived. I would have found a way not to survive, because it was truly unbearable. Sorry.
I went to the hospital and I knew it was bad, but she was, I can't even tell you, watching, you could see how bad it was. It's nothing I've ever experienced anything that bad. And it wasn't what she was saying, or you could see it. And she just didn't even want to go on. The pain was so bad. She's not only my youngest sister, she's one of my very best friends. I love her dearly, and we all, the whole family and all the people that know her, love having Dana around because she's fun. I want her to know that I would do anything in the world to make things better for her.
Experience the Pain Center of Arizona and get back into life. Call 1-888-PAIN-CENTER.
My name is Logan Mosier, and I'm Dana's nephew, and I'm also a producer and a writer and director for the Pain Channel. When I started with the Pain Channel, we were working a lot with the Pain Center of Arizona, and specifically with Dr. Stephen Siwek. And I know Dana, having had 4 surgeries that didn't go particularly well, is not someone who's always been a big fan of doctors. So I called her and I hesitantly brought up that I was working with a guy named Dr. Stephen Siwek. And immediately her eyes just lit up. And she said, "Really, Dr. Siwek? That's the one doctor that she actually had a good relationship. The one doctor that she trusted was the guy I was working with."
So I flew back to Hawaii. It helped for a while, but gradually the pain came back again. Again, and I lived with it for several years in Hawaii. And very recently, I just reached the end of my rope. And so I decided to fly back to Arizona again to the one person that had given me help, and that is Dr. Siwek at the Pain Center of Arizona.
We're doing a piece for Michael Roman, who's been on the Pain Channel a couple times now, and we went to an office in Tucson. The meeting was for a spinal cord stimulator trial, and there were only 4 people there. And one of the people in the office, as soon as it was mentioned this, she said, I already tried that. I'm not interested. It hasn't worked for me. And Michael Roman said, "Hold on. Give me an hour. If I can't convince you, you're free to go." And I watched him talk about the advances that have been made in spinal cord stimulators, the way it had changed his life, and I watched how that deeply affected that woman. I mean, by the end of the trial, it was like they were best friends. It was incredibly emotional, and immediately I called Dana and I started asking her questions about spinal cord stimulator. Had you tried this before? Have you tried it recently? What brand did you use? Did you go this? And it was just important for me to pass on that knowledge. And I got a call from her a few months ago, and she said, it's too much pain, it's too much to deal with. It had reached a breaking point. So I contacted Dr. Siwek and was able to set up an appointment for Dana, and she came all the way from Hawaii specifically to talk to Dr. Siwek, and he said, "Let's try a spinal cord stimulator trial." And if this trial can do something to where it doesn't hurt for her to be herself, that would mean everything.
I still want to be one of the normal kids. I want to feel like I felt in the swimming pool. So that's why I'm back in Arizona again, is to see Dr. Siwek.
Well, I can tell you that surprisingly, and I mean that honestly, but surprisingly, it went really, really well. You have to understand that Dana has hardware. She's got these huge rods and these kind of struts across them. It looks like railroad tracks from the bottom of the thoracic spine all the way down to the tailbone.
Procedure went great. Going in, we were a little concerned that there could be some bumps in the road. Anytime a patient has had surgery before, or in her case surgeries, or anytime a patient's had a spinal cord stimulator trialed in the past, I almost expect to run into some scar tissue. I also wasn't sure to what degree the surgically placed hardware was going to create some roadblocks for us. And to be honest, it absolutely went as good as it possibly could have.
So a lot of times when we'll do the initial testing, we'll shut it off, we'll make a little adjustment, turn it back on, maybe make a move or so. So we do the final adjustments, and right before we get ready to secure it and tape it in, we'll shut it off. And we shut it off, and she says, oh no, don't shut it off. So the good news is that all immediate looks at this appear that it's working, it's helping her, it is at least giving her some comfortable tingling in the areas that 30 minutes ago were just horrible pain for her. On our first visit, she told me that one of the things that she can't do is, I can't even go to a movie and sit down for a couple hours because it's so horribly painful. So I told her, well, one of the first things she needs to do in the trial is get over to the movie theater, turn this thing on, and see how she does.
She's going to go home now and wear it for just short of a week. During that time, I want her to be active. We didn't put this in so she could sit on the couch more comfortably. I want her to go home and intentionally try and do some of the things that she knows she typically can't. And when she comes back, I want to hear some of those activities. How long could she walk for? How long could she sit for? Did she go to that movie and a show that she's wanted to do with her husband? That sort of thing. And based on that, we'll make a determination as to whether or not implanting this is the right thing for her.
The trial will be all about level of functioning, quality of life, stability of pain control, now with her ability to turn this thing on and really reproduce that comfortable tingling. If this works as well as we expect it to, she'll be able to do a whole lot more with a whole lot less pain.
I have trouble picking up my tiny little dogs. I can't pick up my 2-year-old grandson. I can't hold him up in my arms. So any of those things that I could do, again, just to sit on the floor and play with my great-grandson, just to be able to walk through a store and pick out things I want, go try on clothes without agony, buy new dresses and try them on, that would be so much fun. I would enjoy it so much. Anything that I've lost that I can get back, I will be such a happy woman. So that's what I hope to get. Dr. Siwek cares very, very deeply about his patients. So yes, there's hope. There's always hope, even if it's just a thread and you have to get on an airplane for 6.5 hours. Never again will I lose hope. Never again. I hope.